The question I consistently get from my patients is, how can I sleep through the night without shoulder pain? I'm going to show you how to do that by how you position your pillows in bed. But I'm also going to show you how you can use sleep to actually heal and to recover. If you have shoulder pain, the most ideal position to sleep in is on your back. On your back, your joints experience the least amount of compression and your tissues have the least amount of strain. So the first thing is the pillow that goes under your head. You want it to be the right thickness so that your forehead and your chin are in the same plane. This is because the nerve roots that come out of your neck into your shoulder impact your shoulder, as do the muscles that attach from your neck to your shoulder. So how your head and neck is positioned is critical for the amount of stress that's placed on your shoulder. I like this buckwheat pillow because you can really hollow out where your head is, and then you can also have support up under your neck. A feather pillow can work really well for this too. The next thing is we need to actually take the weight of the arm and support it so it's not pulling down on the shoulder joint. So if you take kind of a thin pillow and bring it all the way up into the armpit like this, your arm can just kind of float in the air on the pillow instead of having the weight of your shoulder dragging down on your shoulder joint. This can give you a lot of relief in your shoulder having the support. And then finally, the last thing is to take a pillow to put under your legs. So what in the world do my legs have to do with my shoulder? Well, your legs are attached to your pelvis, which is attached to your trunk. The position and the pull and the alignment of your trunk has a lot to do with your shoulder girdle because it's the foundation that your shoulder girdle sits on. So if this is supported well, your shoulder girdle will be more supported so that your shoulder has less stress. So the most ideal position to sleep in if you have shoulder pain is on your back. What a lot of people come back and tell me is that during the night at some point they end up rolling over on their side and compressing their shoulder. So what I found really works is if you just start on your side. And if you position pillows to distribute your body weight evenly so your shoulder doesn't hurt. So let me show you how to do that. If you could go ahead and sit up. I want you to consider that first, for most of us, our shoulders are wider than our waist. And so when we go and lay on our side, that puts all the pressure on our shoulder. But if we can fill in this space with a pillow, and I personally like to use these buckwheat whole pillows because they adjust to anybody's body dimension. If you're a great big football player or a swimmer with wide shoulders and a narrow waist, you can push a lot of the buckwheat right up here so that your shoulder gets a lot of relief. And then if you're not quite that wide, you can just level it out so that it matches your body more precisely. If you don't have one of these pillows, you can just use a normal pillow, take some bath towels, fold them, and slip them under this side to build this side up where your shoulder is. So then, if you're going to raise your body up here, we've got to raise your head up too. So I'm going to place this pillow here now, and Scott, I'm going to ask you to lie down and place your shoulder right in this little crack here between the two pillows. Perfect. So placing this pillow here allows for relief of pressure on the shoulder. See, I can slide my hand right under his shoulder, and it also allows the spine to be straight. Whereas if I take this out, go ahead and lift up, Scott. Now, I can't get my hand under his shoulder, and his spine is side bent like a smile. So this is all not neutral anymore. Go ahead and lift up again. And then right there. Yeah. So now his spine is straight again, and I can slip my hand right under his shoulder. And that's the value of having this pillow. And it's, again, nice to have an adjustable one. So now, I'm going to readjust these pillows to honor the position of his head and neck, which actually comes off of his body at a slight angle. So I'm going to bring these here. It's nice to have a small feather pillow or a buckwheat pillow here that will allow you to put some of the thickness right under the neck, and then the head can lay there. So this is perfect because his forehead and his chin are in the same plane, which means that all the little openings along his neck where the nerve roots come out or have as much space as possible, which is critical because the nerves that innervate your shoulder come from your neck. And the muscles in your shoulder, many of them come from your neck. So the position of your head and neck is critical for taking care of our shoulders. Now, if I had my choice, I would hope that the shoulder that's painful could be the one on top. But for a lot of people, for some reason or another, they have to sleep on their painful side. So luckily, this position will allow you to not have pressure on that painful side if you have to sleep on it. But hopefully, if this is your painful shoulder, we need to really support it. So we're going to take a great big fat pillow here, followed by a thinner pillow here that we pull all the way up into his armpit and let his arm just rest on it so like it can just feels like it's just floating, but it's supportive. You want to make sure that the elbow isn't too high and the hand isn't too high, or you'll lose blood flow and it'll feel numb. So just to where it can just come out and be supported here. And then finally, we're going to take this pillow and put it under his top leg. Right like that. Pull it all the way up to the top of his hip. And so this is important because it takes stress off of the pelvis, and so that the pelvis can stay right where it needs to be, so it's not rotated at all. And when the pelvis is straight, the spine will be straight. If the spine is straight, then the shoulder girdle will be sitting where it needs to be. And so the next question in your mind, I know, is you have got to be kidding me. I need to use all these pillows? The answer is yes. And if you go to the trouble of doing it, you will thank me because it'll allow you to sleep better during the night. And we don't want to use our sleep to compromise our ability to play the sports we love and do the things we love to do. We actually spend a third of our life sleeping. So it's a big chunk of time to use well. And what my patients often tell me when I get them in this position is they're like, man, I could just go to sleep because your body feels so supported. It can start releasing all that tension we've been carrying around during the day and just let it go. And that's a really big deal. And so if you want to compare what it's like to not have these, you start taking the pillows out. All of a sudden, this knee is bearing the weight of this one. This shoulder starts to hang down. You can see where it starts to put a little bit of stress up into the neck. And if your shoulder hurts, that definitely isn't going to feel good. That's really narrowing it and compromising space here. Now if I take this out, you can see what he looks like here. And then he'd probably come down to just one pillow. This is typically the way most of us sleep, here, like that. And so that's a big stress on this shoulder joint. There's a ton of compression here. And there's nothing helping to take the load up through here. And so what people come back and tell me is that when they start doing this, sometimes the pillows will end up everywhere in the first couple weeks. They might sleep in this position for about 2 hours, which means you have 2 hours of decompression for your joints and support for all your muscles. And then if you lose the pillows, it's okay. You really can train yourself to do this. And then the next thing, if you could sit back up, Scott, the next thing people ask is, what if I roll once I'm in this position? So go ahead and lay back down with your shoulder right there. What you can do is you can sandwich these pillows between your legs and your arms. So go ahead and bring this arm right under there. And if you need to roll, just go ahead and roll, because this pillow's not moving and these pillows aren't moving. And then there you are. And you really can train yourself to do this. I sleep like this, not every night, but when I'm hurting, I do. And you kind of get in this twilight phase where you can not be all the way awake, but you can be aware enough to where you can swap these two pillows out and get them right there again where they're supporting you. And it makes a huge difference. My name is Rebecca Kern Steiner, and for more information, you can contact us at New Dimensions Physical Therapy.